I am Marisa Clifton. I am the program director, and I have a lot that I want to say about our wonderful experience at Hopkins. I am not a Hopkins lifer. I've been around to a couple of different places, including residency training at Mayo Clinic and fellowship at Cleveland Clinic. And then I actually worked in the outside world in a private academic situation, and I came back to the Brady. And the reason I came back is because there's nothing like this place in the entire world, and I really do feel like I've come home. And I'm going to talk about how we've structured our education and maybe some of the great aspects as to why you should consider our program. So we've talked about the clinical experiences, and I just want to highlight we are not just a cancer institution. We have a robust pediatric urology department, endourology, and then female urology and reconstruction. And I really like the fact that Dr. Parton has put us over at Bayview. So we have a collaborative group of reconstructive surgeons that are taking on some of the most complicated cases that are out there. And I'm really surprised how much has changed since I was a medical student here at the Brady. We have infertility. There are a lot of programs that don't have a dedicated infertility and andrology expert, but we have Amin Harati, and he is just fantastic and is doing everything, is on the cutting edge, and his research is also on the cutting edge. Our minimally invasive and robotic surgery experience is incredibly robust. Clinically, you will get an incredible education, but I'm going to talk a little bit about our augmented simulation experience that's very exciting, and I think one of the new up-and-coming aspects of our curriculum. So we briefly talked about all of the exciting expansion that we're doing, but the majority of the residency program experience occurs at Johns Hopkins Hospital. And there you work with a lot of the oncologists, the pediatric urologists in the pediatric hospital, and spend a lot of time at downtown. Now, Bayview is becoming a little bit more exciting because we have so much reconstruction that's going on. And that's where I really think you have a chance to run your own clinic and to work with reconstructionists, think about patients in a slightly different way, and experience a different hospital experience, because Hopkins Hospital is very academic. Bayview's a little bit more like the private practice world. So you get a little bit of a variety. We do operate a Green Spring station as well, and these are all outpatient procedures. So it's nice to see an efficient, well-run ambulatory surgery center, and our residents get to experience that. We have built-in electives, and I want to take a quick minute to say that my goal as a program director isn't just to project what I want you to do. I want to know what your goals are, and we work together to make sure that we fulfill your goals, not just ours. So I'm meeting with the residents really consistently to see what we need to develop to expand what they would like to achieve. So I've had residents work with private practice groups outside of Hopkins. I've had residents spend time with pathology. I have a resident who's doing a lot within safety and quality, which of course I'm passionate about, as that's one of my roles. So really, when you come here, we want to build the experience to tailor to your needs, and you'll see the case volumes change based on what our resident interests are. So I think it's really an exciting experience for all of our residents, and no resident experience is exactly the same, but you'll hear from Dr. Harris in a few minutes, and she'll tell you what it's been like for her. As Dr. Alof highlighted, we have a very diverse community, and with that, I think gives us just such a unique educational experience. You communicate with people from different backgrounds, from different experiences, and you learn different value systems. And I have to tell you that being a practitioner here in Baltimore has challenged me to think about things in a different way. So my patients are wonderful. And I tell everyone that when I came here, I was surprised how much I truly enjoy working with the patients here in Baltimore. And I think you will as well. So we also have refugee populations, and our residents are able to experience their own continuity clinics, specifically at the Hopkins Outpatient Center, but then also at Bayview. So you get two different almost patient populations that you get to work with on your own with the supervision of the faculty, so that you can build your experience before you go out in the professional world on your own. And I also want to highlight that Dr. Brian Metlaga is one of our urologists who works very closely with the international office. So he engages a lot with our international patients that come back and forth to Hopkins. And so that also is a very unique experience that I think we can offer here. Now, what really sets Hopkins apart from everything else? Well, I have to tell you, it's a lifelong dream to be able to work here amongst so many great attendings, and really the residents. They are just inspiring, the staff, the hospital, just everything that's going on at Hopkins. You are never going to be bored. But what really, I think, sets us apart is that we build future leaders in urology. And if you take a chance to look at our webpage, you'll see all of the chairmen that have graduated from this program. And I think that really does talk about the experience that you get here at the Brady. So when you come, you're going to work with the innovators of the field. I don't think you can run into bigger names than you see here. And the great thing is they're wonderful people too, and they help develop your professional experience and not just what they want you to do. So I think that's very unique. I also think we have a very broad educational curriculum. We're not just doing Campbell Walls chapters. Every month, every quarter, we're looking at our curriculum and trying to evolve and make it better and more beneficial for our residents and our patients and our faculty and our other learners in the department. I think you get a research experience that's unlike any other. You will be productive. You will know how to write papers. You will get those papers published, and it will become a second nature. It's amazing how many innovative ideas come from our residents, and they come to me and say, hey, this is a great topic. Can we think about how we're going to publish it or how we can do some more research? So I'm constantly being challenged by our residents and our faculty to really pursue research. So I really think the research experience is something amazing. And I just want to highlight our recent Doximity results that show that Hopkins is the #1 in terms of research productivity and residency. It really is a focus, but it's not the only focus. So a little bit more about research, and if you're really interested, we have a few videos that are on our webpage that you can look at and really see what the projects are that we're working on, and that it ranges from translational lab work all the way to clinical, all the way to theoretical. It's amazing how robust the research program is. Of course, our alumni set us apart. It's great to go to meetings and know a lot of people in the room, our faculty, our residents. They challenge me every day in a really positive way. It's just such an amazing aspect to have in my life that they push me to be better and better as an educator, as a surgeon, and as a person. And then also our fellows, they're the top of the top, and they're just fantastic and work so well with our residents. I think also what sets us apart is we are teaching our residents to be teachers, to be educators, to be leaders in the field of urology. And our residents run their own wellness program. We know in the midst of COVID and all of the other aspects that are happening in medicine and academia, we need to be robust, and we're building a wellness program, and our residents really push the faculty to really say, hey, we need to be well, what can we do about it? And I'll talk a little bit more about the initiatives that they've done, and the residents have the faculty have kind of piggybacked off of it. We do have a commitment to diversity and inclusion, and I think a really unique aspect is the access to a university. I've taken classes myself through the School of Public Health, and there are just incredible opportunities that are available not only to our faculty, but also to our learners. So our residents, they're great. These are some of the wonderful screenshots that we have. Some of these pictures are a couple of years old. So that being said, our current PGY ones that Dr. Parton showed don't have their up-to-date photos. So more to come on that. But I really want to highlight how wonderful and amazing our residents are. And I think when you get to meet them, you'll see why Hopkins is so great. Yes, we have great faculty and research, but we have some amazing residents. So these are a few of the pictures that we've taken. Most of them are at Bayview, but you can see, look at that Brady swag. That jacket is incredibly comfortable, and I wear that everywhere that I go. But you can see two of our residents here, and then we have a fellow here having a snack in between female urology cases. And again, we collaborate not only with urology fellows, but this is a female pelvic medicine and reconstructive fellow that works with OBGYN, and I'm part of their core faculty. So they come hang out with us, but it's been such a wonderful and collaborative experience for everybody involved. This is a picture kind of in the midst of COVID, taking a picture of the dome, again, seeing our amazing residents. And this is Dr. Sean Fletcher, and I made marshmallows and cookies, and they got their Christmas or their holiday gift from me. So I made them have a hot cocoa party. So yes, we force things like hot cocoa onto our residents, but I think it was a great experience, and we like to do things like that throughout the year. Here's Dr. Biles and Dr. Fletcher, and I'm not sure what case that they're working on, but I think they were secretly having a competition about who could look, I think who was taller, I'm not sure. But anyway, those are our residents, and you're gonna get to listen to Kelly talk, Dr. Harris talk a little bit more about her experience as a resident. And then I'm gonna show you that you should attend the meet and greet with our residents without any faculty so that you really learn about our program and our residents. Briefly about our academic schedule so that you know what you're getting into. We are a 6-year program. The first year we do spend 6 months with general surgery, but we have a very close relationship with them. Dr. Pamela Lipset and I collaborate to ensure optimal education for our urology residents as they rotate through. And I just have to say, most of our urology residents that go through are a welcome addition to general surgery, and very frequently they're getting winning Intern of the Year awards. Just says how great our residents are. You'll spend 4 months on the adult service where you're taking consults, you're doing a lot of cases, you're learning how to do bedside procedures, and that's overseen by our PGY3, who is serving as the chief, and then also the oversight of our chiefs at the Hopkins Hospital. You will spend a month on Green Springs Station, which is our ambulatory surgery center. That's where we do all of our prostate biopsies and cystoscopies, and you get a nice 1 month of vacation spattered throughout the year. So it's not too shabby for your intern year. Your second year, you spend more time at Green Springs Station, but importantly, you're going to be working on the adult service, and you spend a month at the SICU. And the SICU experience has been really great, especially as COVID was at its height. We were able to allow our residents to moonlight and work with our ICU teams. And I just have to say that they did a fantastic job, and they really get a lot of experience from the SICU rotation. So I think the residents will say it's a really great addition to their experience. You spend a month with the pediatric urology team, a month at Bayview, and I really love working with our PGY2s and helping build kind of the reconstructive experience. And then we have a night float system, which I'll talk about in a few minutes. And this is great because it really prevents workout violations, allows you to get on a schedule, and prevents you from getting fatigued so that you can optimize your learning experience when you're in-house. Your PGY3 year, you have a junior adult chief experience where you're really the chief of your own service. And I think this has really allowed our residents to grow in their autonomy and their ability to become leaders. And they oversee our medical students and then the interns and their experience, and they help manage and navigate some of the complex issues that are at Hopkins Hospital. So far, it's been a great experience, and we've really enjoyed this. You have more time with peds, about a month and a half, and again, some night float is built in. You will spend a good portion, 4 months, on the adult service at Bayview. And this is really also a great leadership experience because you'll be rounding on your patients. You really manage the patients with the attending. The chief, of course, is there to supervise and help out, but really a lot of the service is run by the PGY3 resident. You have independent time in the OR with your faculty members. You get to pick some of the cases you're doing. And I really have seen the growth in our residents since we've changed how we do these rotations, and it's been universally well received. Your dedicated research year is dedicated to research. You do have some administrative tasks, but we really don't overload you with clinical expectations. In fact, you really don't do anything clinically at all. If you want to do some moonlighting, this is your opportunity, but we find that this is a great opportunity for people to recharge and to focus their research even further. And we're going to discuss the research experience in a minute. So it really allows you to push out those research projects, work on your niche, publish those papers, and develop your research portfolio. Then during your PGY5 experience, you'll spend a third of the year as the senior chief on their 2 different services. Well, there are actually 3 different services that you rotate through. And it's really a mentorship type of experience. You're working very closely with the faculty on your service. You are heading up the surgeries. You are becoming the teacher of the junior residents who participate in your surgeries. And so it's really a great experience. Then by your PGY6 year, you're going to have that independent experience in clinic at Bayview Medical Center, but you're also going to be the chief at Bayview, supervising from a distance, but always being available for the junior residents and helping them grow and teaching them how to be leaders. The pediatric chief experience is fantastic. You run the services, you do the cases, and we do a lot of very large pediatric urology cases with Dr. Gerhardt and Dr. DiCarlo. And then the Parton service, this is a great new experience. This allows you to spend time with Dr. Parton. It also allows you to do some elective times and to spend time working in the areas that you're most interested in. So the electives are built into that experience, and we talk before you start that rotation so that I can make sure that you get the experiences that you want to accomplish and not just sit back and not do it or just do what you're told. So I think that it's been very well received. Briefly about call, we do have a night float experience, which really I think has helped the quality of life of our residents. The only exception is that on Friday and Sunday, you take all day call, and then you're going to take all 24-hour call on Sunday, but then someone else takes Saturday call. So the weekends are the exception to the night float. But the night float allows very consistent patient care, sign out, and follow up. And our residents are able to kind of stay up throughout the night and not be fatigued. So that way we're checking labs and making sure optimal patient care happens. And you always have backup chiefs if there's an issue so that someone comes in to help out at any point in time. So we have a lot of backup mechanisms to ensure residents don't get fatigued and ensure our patients are well cared for. Briefly about the curriculum that we have a Tuesday education conference where we cover AUA guidelines, oncology, reconstruction, indications, and then we also do professional development. I like to call it the hidden curriculum, and this is sometimes taught by content experts, and other times it's by residents who have interests in these various aspects. And so it's been a really great experience overall. Everyone has grand rounds. Our grand rounds are fantastic. The nice thing, there's not a whole lot nice about COVID, but what it did allow us to do was expand who we were able to invite to these educational conferences. So we've had content experts throughout the country come and give us talks, and it has just been a phenomenal experience. And it's great for our residents to be able to meet these leaders in urology and other fields and learn the content. And we can do it on a Thursday with the faculty and the residents. So that is one positive that we've really had. We do Journal Club, we do Quality Improvement Conference or M&M, and we have invited lecturers, and then also our residents give a lot of the lectures as well on their research and on current topics. We have multi-D clinics that include prostate, bladder, and testis and oncology. We also have a pediatric MDC, and the urogynecologists we have an MDC of sorts, and we have a urogyn curriculum. So anyone interested in urogynecology or female urology, a lot of additional added benefits. Briefly about the robotic simulation and curriculum, some of these slides are a little bit, I'd say, not as exciting as when I get to the end and I show Dr. Cohen and his prostate. But we really do have a curriculum that's structured so you get your Da Vinci certificate, and that way when you apply to be credentialed after graduation of residency, you can slide right in and do robotic surgery. We start this early so that we identify any needs of the learner, and we can augment that so that their experience is even more robust. So when you sit at the consult as a junior resident, you're going to do a lot more on that robot than maybe the general urology resident out there. So we work with the APP team because they're really great first assistants. So they teach you all of their skills, but then they get to sit back and do those assisting while you're at the consult. So it's great that we have the APP team involved because it allows our residents a lot more autonomy on the console. And these are some pictures. We recently formed a collaboration with University of Rochester, and I have to thank Dr. Andrew Cohen for his help with this. And we now have prostate models that very accurately reflect robotic prostatectomy. We're able to do anterior approach, posterior approach, and Dr. Cohen was able to do a radical prostatectomy himself, I think for the first time in 2 or 3 years. And all of that data is being tracked and sent back for simulation research. But that being said, our junior residents are allowed to do a whole lot more on these models, and I have to tell you, it's a really, really awesome model. They actually can measure the tension you put on the nerves as you drop them down from the prostate. So more to come on this, and I'm very excited about this initiative that we're offering. And this is an additional to the animal labs that we have. Dr. Alof also gives annually a robotic experience that our residents are invited to. So we have a lot of collaborators that make this a robust program. Briefly about our research curriculum, we do have a few aspects I want to highlight. You are paired with a mentor. You do have consistent mentorship. You do have follow through. These research activities do get published. It's not like you're spinning your wheels. You will get productivity and you will learn a lot about research. And we're really lucky because Dr. Parton is going to be able to help out more in this aspect as a mentor in research. And so we have so many research opportunities and mentors that are involved in every aspect of urology. So if you have an interest, we can find someone to work with. And then briefly about mentorship, we do have a very proactive mentorship experience. Dr. Cohen and myself help with the PGY 1 and 2 experience to make sure that we're getting you up to speed on a lot of the aspects of urology, your surgical experience. If there's anything that you want to work on, we work on it with you. And then you select your mentor, and this mentor becomes the person that you can go to with questions. You can have multiple mentors, but the one academic mentor really ensures that you're meeting your guidelines, you have your goals in place, they're helping sponsor you so that you're successful throughout your residency experience. Now, briefly about autonomy, we have a lot of autonomy here. And again, because we have residents interested in different aspects of urology, you're going to have different case volumes based on what you're interested in. So here is just a case log from one of our residents who is very interested in reconstruction. And even with his very robust interest in reconstruction, you can see he has huge oncology volume. But he's focused primarily on reconstructive urology and then was able to complete a fellowship and is currently a GERS fellowship trained urologist in practice. Wellness is very important, and we have a lot of different ways that we are integrating it. The residents have exercise equipment, I think a gaming station, we have phone sanitizers, phone chargers, we do happy hours that are virtual. We try to think of any way that we can to support the resident experience overall. We do integrate wellness into our curriculum and into our journal clubs because it's important not only for residents, but other learners, APPs, staff, and faculty. We had a co-ed, a sports team, a soccer team. Unfortunately, because of COVID, we had to put that on hold, but I'm looking forward to resuming this in the future because there was a lot of participation and interest. We do have a Peloton, and our residents compete against our faculty on their Peloton races. I have not ever shared my Peloton profile because I don't ever want a resident to know who I am, and then they will just, I think they would just completely defeat me on the scoreboards. But we provide this opportunity for our residents to get a little bit of physical activity even when they're in the hospital. We have some diversity and inclusion efforts, and you heard briefly about some that we offer. We also have a diversity committee here. We participated this year in the virtual elective in equitable health. Our GME office is very proactive and has opportunities, including a subcommittee on diversity, equity, and inclusion. So a lot of opportunity if you're interested. And why Baltimore? And I'm just going to say that I was not a Baltimore lover when I was a medical student here, but I have to say, since coming back, this place really does feel like home. My kids have a wonderful experience in the public school system. They have a lot of friends. They love the neighborhood. My husband loves it. And honestly, I love it. I get to go to different restaurants. I get to experience some great cuisine, better than many of the other places, any of the other places that I've lived. And it is becoming a chic place. So you can see it's not just me that thinks that. We have a couple of references so that you can peruse those as well. And these are some of the pictures. I think they're a little bit maybe edited, but we have a lot that we can offer. We have an aquarium, we have sporting events, we have nature. You are a drive away from DC, New York City. If you want to travel, it's so nice. I lived in places where we didn't have airports. You can go to BWI and you can get everywhere, which is fantastic. And hopefully when COVID dies down, we'll be able to do that.